Hey everybody, it's Dr. Rimka with Brain and Body Revolution and Brain and Body Solutions. So, this has been an interesting time. It's been a very powerful week, and there's been a lot of change and disruption in lieu of recent events and some of the self-isolation, self-quarantine requests that are going on in the country around the SARS coronavirus variant that you're all watching about and following all over the news and all over social media. I'm going to go over some maybe less talked about concepts, and then I'm going to go through is it hype, is it fiction? So it's kind of a two-part lecture right now. I hope this will be helpful. I hope if you like it, you will share it with your friends and family because it's not something I'm seeing heard said a lot. And I think it's important we talk about it. So you notice my title said, compassion is your secret weapon against the SARS virus, right? So it's not a supplement, it's not a vitamin, it's not a therapy. Why am I talking about this? Well, I'm going to suggest we talk about things in a little bit of a different manner that maybe some people aren't talking to you about right now. I like to look at things always in terms of where can I find the highest purpose in the light? Here's a question I want you to ask yourself, and this might push some of you, but I want you to ask yourself at some point when this is over, how is the coronavirus here, this specific mutation, this new thing we're seeing, how is it here to serve humanity? This is the question I want you to ask yourself. Why? Here's the thing. Simply asking this question will force your brain into a state of gratitude and compassion. Why would I want you to do that? Several reasons. First, I implore you to always see there's a purpose of light in every situation. I can come up with a dozen reasons why this pandemic, which is not a hoax, may be a huge cause of eventually a more holistic approach to healthcare happening in our future. It may be a huge driver in an overhaul of the way we approach sick leave and childcare in this country. You know, there's a lot of things I can come up with in my mind, stories I can make up that make this a positive thing, how this is going to serve me. So how is this here to serve me? How is this here to serve humanity? I ask you to push yourself into asking your brain that question. Why overall? Because I'm going to talk about emotions a little bit. Ultimately, in December, I gave a lecture to about 300 doctors for continuing education, and my topic was psychoneuroimmunology. I was there to teach doctors about a field of study and research called psychoneuroimmunology, talking about psychology, thoughts, thinking, neurology, brain and nervous system structure, and immunology, the immune system, how well you can fight infections, let's say, right? And I just recently went to a huge one-day lecture conference for continuing ed myself about this very topic. And what I thought I'd be giving lectures about in all of my online learning courses and to add to my patient care this month were things about how emotions and trauma are related to causing autoimmune and chronic inflammatory conditions. This is how I help so many patients get better and what I teach in my online learning courses. But right now, we have a current national emergency to address that is still actually about the exact same thing. So we know in healthcare that chronic stress states suppress the immune system, and they also reactivate latent viruses in the system. This is a really big deal for people dealing with autoimmune disorders and chronic inflammatory conditions. And it's a way when they come to me, while I talk about emotions and trauma that no one's ever talked to them about, and how does that relate to my illness today that you've had? Well, I make it all make sense, but right now we're dealing with it on a different acute kind of level. So what we know in the research that goes into studying these things and how trauma is related to autoimmune disorders later on in life, we know that some of the largest influencers in hormones and immune system health come from the power of the social world. What we know is that negative social contexts negatively affect biology and health. What does that mean? What that means are things that you really know about and are well understood and totally socially accepted in our culture, that big things such as loss and bereavement have a negative impact on your health. People going through that, right, have increase in stress hormones, increase in inflammatory cytokines and things like that, and have suppressed immune function. We understand that. That seems to make sense to people, right? We have it clinically proven. However, something you might not have known about is the power of loss of social status or perceived less than, and shame status on your immune system. So what is shame? Shame is feeling less than, being ashamed. It has the greatest negative impact on your cortisol response, which is an inflammatory marker that breaks the body down, your nervous system adaptations, whether you're in a fight or flight state or a parasympathetic rest and digest where you can heal, and your immune response compared to any other emotion. So why is that relevant right now? I want you to think in terms of what's going on with the coronavirus, self-quarantine, the shutdown of all the schools, the shutdown of these events, the gatherings. Let's think about that in terms of the socioeconomic class and status. Who is under the most duress right now because of financial status shaming? Who is being shamed for buying toilet paper? Who is being shamed for being afraid? Who is being shamed for going to work despite not feeling well? I've been seeing it all over social media. I've been seeing people call people hysterical. I've seen them called lunatics. I've seen them called idiots. That is shaming someone, and that is lowering and destroying their immune system. Another major player right now that we know affects overall health is isolation and loneliness. They have devastating effects on the nervous system and the immune system. What has been clinically proven to have enormous impact on the immune response, especially in those over 65, where this virus really hits strongly, is social support. Over 70 studies have shown that the feeling of loneliness predicts a 30% higher chance of dying from anything compared to having regular social contact. Social support protects you from the effects of acute stress on your physiology. So here's the things we know. So we have compassion, I've talked about, social support. So shame destroys your immune system. The cure for that is compassion. Compassion is a physiological state that when you can feel flooded with thoughts of compassion, acts of compassion, watching a movie about compassion, changes your physiology, whether you are trying to or not. It just does it. And it increases something in your immune system called immunoglobulin A. It makes it very high for 6 hours after whenever that happened. So you're somewhat kind of bulletproof when it's really high. So here's the thing. If you're feeling scared, negative, worried, you're losing sleep, these are like some of the, worst things you can do. But the very worst thing you can feel on your immune system is shame. You are literally destroying your immune system by lowering the immunoglobulin A and flooding your body with extremely pro-inflammatory chemical messengers. Shame is the biggest threat to immune system health on an acute level and a long-term chronic level. It is at the root of all autoimmune diagnoses, by the way. So While I'm going to go over supplements and gadgets in the next segment by you emailing us, I'm going to make that and send it to you, full list of all the things that I'm taking, I'm ordering, I'm giving, to my mother. Here's something that I want you to understand. Please know that you hold a great power of controlling your immune system directly by exercising control over your thinking. No one is in your head but you. You must learn to master your thoughts right now. They lead to generating your emotions, and your emotions generate your chemicals, and your chemicals are controlling and are your immune system. So here's the thing. I'm going to need you to build that immune system real strong with your thoughts. That is 100% free, by the way. They aren't running out of it at the store. You can do that in complete quarantine. No one can take it from you. So I'm asking you to learn to discipline your thinking, and I want you to flood it with compassion. Compassion is the antidote to all of this. It bolsters you physically, emotionally, and it makes you an amazing person to be around, to be behaving and acting in a compassionate way. So how can you do that? You can read about it, you can talk about it, you can watch stories about acts and lives of compassion, because it's been clinically proven. Just watching a documentary about compassion will increase your immune system for 6 hours. And watching or reading and thinking about acts of non-compassion will do the exact opposite to your body. It will lower your immune system, make you susceptible to the virus for about 6 hours. So this is what I'm suggesting. Now is the time to check on your neighbor. Are they immune compromised? Do they need help getting stuff from the store? Are they food insecure? Are they wondering how they're going to feed their children now that they don't go to school and they were expecting that 1 to 2 free meals per day? Do they have small children now that they can't go to school at all and they're going to be overwhelmed not knowing what to do? Are they a nurse that needs help so they can go to the hospital? Because did you know that 30% of all nurses in America have children in school? So if all the schools are shutting down to protect widespread infection rates, to slower and flatten the curve, as you've heard, well, what is she to do? Can she go to work, or should she leave her children home? Maybe you can help watch your kids so she can go to work and help save lives. Can you pool resources? How can you support each other? Can you share food? Can you go shop for someone who can't, right? Can you spend time talking with each other outside under the sun and getting fresh air, decreasing any, infection rate, but not necessarily being completely isolated all alone? Can you blow up your book reading and your Netflix with documentaries about people consumed with compassion and showcasing those lives instead of violence, war, murdering, crime, right? Can you fill your life with comedies and laughter? Your body has no choice but to respond with the appropriate chemical release to whatever you input into it. So I'm asking you to guard your thinking, guard your sensory input, guard your reading, guard your watching. Spend a long time holding thoughts of compassion, kindness, gratitude, and purpose. When the scared, shameful, resentful thoughts come up, and they will, you simply quickly release and switch that thought to something that feels good. Feeling good makes good chemicals that make you strong. Okay? You cannot stop the thoughts from coming, right? It's not the point. Everybody has the thoughts, they're going to come in. It's just really how long you're going to hold on to it. So, I had to call my mom today and have a conversation with her about what I want to go on. And I had to do it in such a way to not cause panic or severe anxiety, but to let her know we're going to make some changes because we are going to take this serious, and we're going to protect you because you're in a higher risk group, right? So There's a difference between, people who are positive and people who are kind of negative. It's the time, all it is, it's the time and attention you give to the thoughts, right? It's just radically different. The people who are positive and feel good all the time, they just hold on to the feel good thoughts longer, right? Because the thoughts you're holding on to the longer amount of time are the thoughts you're going to create. So I gave some attention to the concerns, but I gave a lot more time to, this is how we're going to solve it. This is what we're going to do. This is how we're going to be prepared, and everything's going to be okay. So she's calm, she's preparing, and we're going to take care of it, and everything's going to be fine. So I'm not ignoring it, but I'm not giving attention to the outcome I don't want to happen. I'm giving attention to the outcome I do want to happen and the steps I need to take and she needs to take to make sure to have a higher guarantee of that outcome that I'm going to spend my time on in happening. So, it's just starting to be disciplined in the thoughts you give your attention to, right? And so what I told somebody in a post on one of my private groups, I'm like, this is what I said. I'm like, it's kind of like dating people. Like, why are you going to spend time like talking to or hanging out with the jerk? The one that belittles you, degrades you, says horrible things, makes you feel like crap. Why wouldn't you swipe right and spend time with the person that makes you feel amazing and feel good and loved and nurtured? Spend time with that person. Not the a-hole, but the awesome one. So that's what you need to figure out to do with your thoughts. Date the thoughts you want to be around, right? So that being said, right, we're gonna kind of do part 2 right now. So this is the part at whatever time we're in here, 17 minutes into this, 18 minutes into this. Here's a few key points that I want to say, like what is real and what is hype. And I've seen people going to extremes either way. Either like this is the most catastrophic thing and it's, the book of Revelation's coming to life and we're all going down. And then I've seen it's nothing, it's all a conspiracy, and this is just the common cold and the flu. I'm going to say this. Both are irresponsible. This is not the common cold, and it is not the flu. Here's a couple ways it's different. With the flu, there's a lot of strains, but we know exactly how the flu works. We know it very well. It's been figured out. There's a clear understanding of all of it. And yet we still can't stop an awful lot of deaths from the flu. And we understand it. We've studied it a long time. This is a new variant. There's a lot of different coronaviruses out there. Some we test for, have been testing for years. This is a new one. The panels we've had don't include this. What we've had available isn't this. This is different in what it's doing and its time frames and things than what we are used to. So what that means is this could be much worse than the flu in terms of the infected. We don't really know. We don't actually know yet. The numbers that are coming in, we know we can't fully trust those. We know everyone's not testing everything in every country. Some countries aren't even releasing their data. Some countries, the data they're releasing, we think they might be changing and manipulating. We don't really know. But we do know this, is that it spreads very quickly. Its incubation period time, that's the time from when you were exposed to how long from the exposure to when you get sick and have any symptoms. Well, with this, that's somewhere in like about 4 days, 5 days, but I've been hearing some different numbers. It could take longer. Here's the thing with this. You can be contagious in that period without any symptoms. It's a very long time that the viral load gets extremely high. That's not how the flu works. The flu hits in a certain way. You get hit pretty hard, pretty much. We know the timeline on that. We know what kind of happens. And you aren't contagious to people until you know you're kind of contagious. That's not how this is. So you can have people who are very well and they're infecting a lot of people. It is airborne. That puts a different spin on things. Most things come from touching something and then touching your face, but this is could be a little bit different. So breathing is a route that's possibly the primary route, not the touching the way the flu is really more touching. We're not really sure though. So again, what are we going to do about it? We are going to avoid public spaces right now. It's a way to decrease the burden on the healthcare system, on the nurses, on the EMTs, on the paramedics, on the ICU units, on the physicians, right? On these first ground people who have to be addressing this. And how many IVs do we have available? How many antiviral medications do we have? So, we're closing school. In influenza, we know it totally helped. This is a little bit different. Kids aren't the big carriers, but it's, still, it is what it is. Questions we have to deal with. Almost 40% of nurses have kids in school. What are they going to do, right? Are we going to help them so they can go to work and try to save some lives? 1/4 of Americans have no sick leave. What about them? Can you spare some kindness, compassion, and resources with them? The stress of the financial and economic burden and fear of losing your home, fear of losing your job, fear of losing food, it is going to be a big issue right now for a lot of people. And kindness and compassion and shaming people for buying toilet paper, shaming people for trying to get water, shaming people for trying to get food because they are so uncertain in a very scary time where this is history right before our eyes and who knows how to exactly behave. I will not be shaming anyone for that. Okay. So this is what we need to know. You can get lung and heart damage. Absolutely. You can even get brain damage, even if it doesn't, kill you. We also know the majority of everybody who contracts this totally survives without any damage. And it will just feel like a flu. That's the majority of people. But let's talk about who's really at higher risk. Because when you start breaking it down to who's at higher risk, that's an awful lot of Americans. And I didn't do the math on this because, again, I was running out of time and just wanted to get into it. But it's not just old people, all right? And it's not children are immune, okay? Even though it definitely seems that it's going to be hitting older populations much harder, and children are going to have very few complications, and many of them will be totally asymptomatic, right? We got that. Different pathogens go after different age groups, and that's a fact of the way infectious disease works. They don't know why yet with this one because they don't know enough about this one yet. But this is what we do know. If you are, there's two big things you need to be aware of. One, if you're in a community of higher contagious concentrations, that puts you at a much higher risk of getting it and being reinfected and just having higher loads hit you, right? Two, here's the risk factors right now. Type 1 and type 2 diabetes, smokers, any lung disease, which would include things, COPD, emphysema, things like that. Also asthma, all right? Cardiovascular disease, that's a risk factor, and that's the #1 killer in America. A lot of Americans so far who are type 1, type 2 diabetics, smokers, have COPD or asthma, have cardiovascular disease. That's a lot already. Now, a risk factor we're going to see in America that's a bigger issue here than we've seen in China, than we've seen in Italy, because this is America. A huge risk factor we have here is obesity. It's going to hit the same way as if you were smoking. It's going to, obesity in general causes severe life-threatening disease and complications in everything. And right now we have, an obesity epidemic in the United States of America. And so we're going to see much bigger issues, I think, here than we, did compared to China, then compared to Korea, then compared to Italy, just because of our risk factors. We are in general unhealthier and have more metabolic disease from our lifestyle. So right now, 45% of Americans over the age of 45, right in my category, are obese. And that is putting you at much higher risk. So I am not concerned about coronavirus infecting me and me having any complications from it. I expect that I will be exposed. I need to be exposed so my body can build up nice antibodies and a better immunity to this in the future. And it will feel like a flu. And I won't have any permanent, and I can mitigate it with some therapies and things and all the things that I'm going to give some of you guys in that PDF if you email us. But I am concerned for my mom and dad because they fall into some of those categories. I'm concerned for many of my friends because they fall into many of these categories, right? If you're a type 2 diabetic that smokes and is 50 pounds overweight, boy, I could name off probably 200 people on my Facebook friends list that fall into that category right now. I am concerned for them. It's going to be harder for them. They have a higher risk of complications. They have a higher chance of, ending up in an emergency room and an ICU, burdening the system and causing more stress and strain and lack of supplies and lack of masks. So anything we can do to mitigate that flow into the hospital is very good in my opinion. And I don't think it's hype, and I think it's smart. This is how it's going to work. If you're in those, high risk groups, you really need to take care of yourself. Stock up with some supplies so you can stay self-quarantined, self-isolated as long as possible. I am not an immunologist. I am not an epidemiologist. I am not an infectious disease expert, right? I work on supporting, peak performance optimization in the human body. I study health. I don't study disease and infection. So this is me researching what I've researched from infectious disease experts and resources and physician groups that I'm in to study things. So here's the thing though, general, everyday things that you can do to support your immune system, things that I do every day, but things that many of you are going to need to start doing because you're in about 88% of the population of America that has an unhealthy metabolic system. You have an unhealthy hormone system. You have an unhealthy immune system. You are not optimized. So you're going to probably have to add a lot of things to help you. But I hope you use this as a wake-up call to start taking this really, really seriously, because there is no miracle drug. There will be no miracle shot. There will be no miracle supplement. But what the miracle is if you're just strong and healthy and fit. So in general, basics about your immune system that you need to know: no sugar, no alcohol, no grains, no cigarettes. Those are immune system killers. Also, no shame, no worry, right? Don't hold on to it, because compassion versus shame, what it does to the system, has the same impact on your immunoglobulins as eating a bunch of cookies. All right? So that's an easy one, actually. So lots of high quality protein, especially DHA containing fish, a lot of fresh fish and ruminant red meat that helps bolster your immune system and helps keep you full and satisfied. So you're not going to want all the sugar and alcohols. You'll get comforted by high quality protein and fat. Frequent hand washing. Do not touch your face. Sunlight, fresh air, and grounding, which is barefoot on the earth and the grass and the soil, are all activities that do something called increase your redox potential, or it's your electromagnetic charge. And what that means is basically just like my iPhone, I have to recharge this battery, okay? Almost every day or so, right? And you have a battery pack inside of you deciding, and that's your redox potential or your charge, and that determines your health. Are you at 30%, 50%, 88%? All right, it's not, it's a really interesting thing, and I teach whole things about this, and it's really complicated, but those things do it. So sunlight, fresh air, grounding. Cold and heat therapy also do this. So cold showers and sauna therapy. You guys have seen, I've done a lot of videos on this page about that. But no, getting in your sauna isn't going to kill the virus, things like that. So really a lot of hygiene, avoiding people contact right now with anybody who's infected. But email us at desk@drrimka.com, and I will get you a list of my top antiviral supplements. And I guarantee there's going to be a few things in there that you never even heard about. And some of the stuff is hard to find, but you sit on there every day online. You try to wait until they're back ordered and sold out. You go in the next day and you keep finding out they're going to be restocked. Get some of the stuff. It's some very easy to resource, some of them common antivirals, and some new antivirals, some that I've never even heard about. But doctors are pulling together all their information, and we're sharing it with each other because we're trying to help people as much as possible. And I guarantee you this is stuff I'm taking, and I'm making sure I have available for my very own mother. All right. Bless you. Take care of each other. No more shaming. It's not worth it. Stop telling people they're idiots for their emotions and for trying to prepare in the best way they know how. And let's see if we can come together and take care of each other at this time. That's what it kind of comes down to, taking care of each other. I think this is a beautiful opportunity for us to come together, start reframing the way we look at things, and reach a new level of preparedness, not only in our physical way, but our physical body and our physical home, but our emotional body and our emotional home. Your emotions control your physiology, and you control your emotions. Period. Thank you. Email us and I will get the information to you. Thank you.